Welcome to the Omnidental Podcast. I'm your host, and today, for this deep dive, we are taking this seemingly mundane daily routine, and we're kind of just tearing it down to the molecular level.
Yeah, it's something everyone does, but nobody really thinks about.
Exactly. I mean, usually when you think about a morning routine, there's a certain expectation of precision, right? You take a specific route to work, you measure out your coffee grounds, you know exactly what each step achieves.
But then you get to the oral care aisle at the pharmacy.
Oh, man. Yes. The second you step in there, that precision just completely vanishes. You're staring at this massive wall of bright colors and swooping arrows and, these scientific-sounding chemical names.
It's totally overwhelming.
It is. The whole landscape is incredibly murky. And honestly, I think most of us just end up grabbing whatever brand we grew up with.
Which means, when you really think about it, we're essentially just guessing about the chemical compounds we're putting into our bodies twice a day, every single day. We're basically trusting marketing departments rather than, actual clinical chemistry.
And that actually brings us to the mission for today's deep dive. We are taking the toothpaste tube, flipping it over to the back, and we're going to decode the actual chemistry of oral care to optimize your gum health. We're cutting straight through all that marketing hype.
I love that. It's so necessary.
To do this, we're relying on a really fantastic stack of sources today. We have a highly detailed clinical blog post. It's titled Best Toothpaste Ingredients for Healthy Gums. And that was written by Dr. Belis Poles.
A great resource.
Yeah. And alongside that, we have the comprehensive service breakdown and patient philosophy from Omnidental. They're a family dental practice based out in Arlington Heights, Illinois.
And I think we really need to establish the stakes here immediately because, this isn't just a cosmetic discussion about getting a brighter smile for your holiday photos.
Right. It's way more serious than that.
Much more. The statistics from the Centers for Disease Control and Prevention that are detailed in the sources are honestly jarring.
What are we looking at?
Nearly half of U.S. adults over the age of 30 have active gum disease.
Wait, half? So if you're listening to this right now and you're over 30, it's literally a coin flip whether or not you're walking around with an active inflammatory infection in your mouth.
A literal coin flip.
That is just a wild reality to sit with. So today is all about giving you the exact practical tools and the underlying knowledge to make absolutely sure you are not part of that statistic.
Yeah, and to really understand the gravity of that statistic, we have to look at where this clinical expertise is coming from. Omnidental isn't just some high-volume generic clinic.
Right.
Dr. Belis Poles has over a decade of experience leading this practice, and they have this deeply patient-first mentality. They handle the entire spectrum of oral health.
So not just cleanings.
No, everything from basic preventive care to highly complex procedures. Think full arch dental implants, root canal therapy, and advanced aesthetic services.
And they're heavily integrated into their local community, too. I mean, they serve Arlington Heights, but also this massive surrounding footprint. Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Deep Plain, and Elk Grove Village.
That's a huge area.
It is. And when a practice is treating that wide of a demographic, seeing toddlers all the way up to seniors across all those distinct communities, they aren't just reading theories in a textbook.
Exactly. They are seeing the raw daily data of what happens when a patient's at-home routine just fails them.
And what's failing very often is just our fundamental understanding of what the mouth actually is in relation to the rest of the body, right?
Oh, absolutely. According to research from the American Heart Association that Dr. Poles references, periodontal disease, which is severe gum disease, is directly linked to an increased risk of heart disease.
Wow.
Yeah. And furthermore, separate clinical studies show that poor gum health is intimately connected to reduced blood sugar control in diabetics.
So it's all connected.
Completely. The oral cavity is not a closed system. Oral parasites and bacteria affect the entire systemic health of your body.
I always kind of visualize this by treating the mouth like an isolated room in a house.
Yeah.
You think, oh, the paint is peeling in the mouth room, the drywall is a little soft, no big deal. I'll just close the door so the guests don't see it.
That's a great way to put it.
But biologically, your bloodstream acts like the house's central air system. Those vents are actively pumping whatever is festering in that isolated room directly down to the foundation of the house, your heart, your major organs, your immune system.
And the biological mechanism behind that analogy is just fascinating. Gum tissue is highly vascular. It is incredibly dense with blood vessels.
Okay.
So when your gums are inflamed, even if they just bleed a tiny microscopic amount while you brush, you are literally tearing open the endothelial lining.
Oh, gross.
Yeah, you're providing a direct, unfiltered on-ramp for bacterial like Porphyromonas gingivalis to enter the bloodstream.
And once it's in the bloodstream.
From there, the bacteria travel down and they actually attach to the fatty plaques in your coronary arteries, which accelerates cardiovascular issues.
That's terrifying.
It also triggers your body's immune system to launch a systemic inflammatory response. And that is exactly what wreaks havoc on a diabetic patient's insulin resistance.
Knowing that this specific bacteria can literally travel to the heart and accelerate arterial plaque, that changes the entire game.
It really does.
The battle we fight every morning and night isn't just about avoiding a drill at the dentist. It is a cardiovascular intervention. And the weapon in that battle is the chemical formula on your toothbrush.
Exactly. So let's look at the baseline active ingredient we all know, which is fluoride.
Right.
Because the sources set up a pretty intense showdown here. All fluoride is absolutely not created equal.
Okay, break that down for us.
Sure. If you pick up almost any standard over-the-counter toothpaste, the active ingredient listed on the back is going to be sodium fluoride.
Right, I feel like that's on every tube I've ever bought.
And sodium fluoride is brilliant for cavity prevention. Its primary function is to remineralize weakened enamel. It interacts with the calcium and phosphate in your saliva to create fluorapatite.
Fluorapatite, got it.
And that forms a highly acid-resistant barrier on the hard surface of the tooth.
So it basically builds a wall to keep the decay out.
Exactly.
But wait, if the goal of brushing is to remove plaque, and plaque is just a sticky film of bacteria, shouldn't the physical act of brushing be enough? Why do we need the chemical to do anything more than just harden the tooth?
Well, because plaque isn't just loose dirt you can simply sweep away with a broom. Plaque is a complex, living bacterial biofilm.
Ooh, yuck.
Right, and it adheres stubbornly to the gum line. So while sodium fluoride protects the hard enamel brilliantly, it has a massive blind spot.
Which is?
It lacks active antimicrobial properties. It does not actively kill or inhibit the bacteria within that biofilm that actually cause the soft tissue, the gums, to become inflamed and bleed.
Okay, so what is the alternative? Because the clinical studies in the Journal of Clinical Dentistry mention a gold standard for gum health.
Yes, the alternative is called stannous fluoride, and it offers a dual action benefit.
Dual action meaning it does what sodium fluoride does, plus more.
Exactly. It strengthens the enamel through remineralization, just like the sodium variant, but the stannous ion itself is a powerful antimicrobial agent.
Oh, I see.
It interferes with the metabolic processes of the bacteria. It effectively starves and kills the specific strains that trigger gum disease.
Wow.
It is clinically proven to reduce bleeding and plaques significantly better than sodium fluoride. The sources actually highlight Crest Gum Detoxify as a prime example of a formula utilizing the specific chemistry.
I'm stuck on a massive contradiction here, though.
What's that?
If stannous fluoride is the absolute gold standard, and it handles both the hard tissue remineralization and the soft tissue bacterial infection, why is sodium fluoride even allowed to dominate the market?
That is a very good question.
Why wouldn't every single manufacturer just switch completely to stannous?
It really comes down to the historical evolution of dental chemistry and, frankly, manufacturing costs.
Always comes down to cost.
Usually, yeah.
Yeah.
For decades, the primary enemy in public health dentistry was the cavity. Tooth decay was an absolute epidemic. So standard formulas were aggressively, single-mindedly optimized purely for cavity prevention.
Okay, that makes sense.
Furthermore, in the early days of chemical formulation, stannous fluoride, which actually utilizes tin, was notoriously unstable.
Unstable how? Like it would explode?
No, not explosive, but when you mixed it with water and the abrasive silica inside the tube, it would break down before you even bought it at the store.
Oh, so it would be useless by the time you brushed.
Exactly. And worse, the tin ions could sometimes react with the bacterial byproducts in the mouth and actually cause superficial dark surface staining on the teeth.
Oh, wow. So a patient's gums were getting profoundly healthier, but their teeth were turning slightly brown, which is a total cosmetic nightmare.
Precisely. People thought their teeth were rotting when they were actually getting stronger.
It's wild.
But modern chemistry has completely solved this. Formulators now use complex chelating agents that bind to the stannous ion, protecting it in the tube and completely preventing any staining on the tooth.
So you get all the antibacterial benefits with zero cosmetic risk.
Exactly. But the market is just incredibly slow to adapt, and to be honest, sodium fluoride is still much cheaper and easier to manufacture at a massive scale.
So relying purely on sodium fluoride is kind of like taking a heavy shield into battle. You can block the acid attacks on your teeth all day long,
Right.
but stannous fluoride is bringing a shield and a sword. You block the acid, and then you actively swing back and kill the bacteria hiding along the gum line.
That's a perfect analogy, and especially if you're dealing with early-stage gingivitis, dropping the shield-only approach and picking up that sword can produce noticeable reductions in gum inflammation in just a matter of weeks.
Finding that sword seems crucial. But the sources dive into a whole supporting cast of ingredients too, because obviously not everyone is just battling bleeding gums.
You're right, there are other issues.
Yeah, a huge percentage of people are dealing with intense shooting pain. When I look at sensitivity toothpaste, I see potassium nitrate everywhere. What is actually happening in the tooth to cause that sharp pain from, like, a sip of hot coffee?
Well, tooth sensitivity is very often a direct downstream result of those gum issues we just discussed. When the gums become inflamed and eventually recede, they pull back and expose the root of the tooth.
Okay, and the root is different from the top part.
Exactly. The crown of the tooth is protected by hard enamel, but the root is covered by a much softer, more porous material called dentin. And dentin is packed with thousands of microscopic channels called dentinal tubules.
So if the root is exposed, you basically have thousands of tiny open straws leading straight to the center of the tooth.
Exactly. Those microscopic tubules are filled with fluid and they lead straight to the pulp where the dental nerve lives.
Oh, that sounds painful just thinking about it.
It is. When you introduce a sudden temperature change like hot coffee or cold ice cream, it causes a rapid shift in that fluid. That fluid movement physically pulls or pushes on the nerve endings, causing them to fire off a sharp, shooting pain signal.
You know, I always assumed sensitivity toothpaste just had a mild topical numbing agent in it, like an oral gel or something. But potassium nitrate works differently, doesn't it?
It does. It works on an electrochemical level. When you brush with potassium nitrate, the potassium ions travel down those microscopic tubules and bathe the sensory nerves.
Okay.
They essentially depolarize the nerve, preventing it from repolarizing and firing a pain signal to the brain. It literally shorts out the pain mechanism.
That is amazing.
Dr. Pohl's post recommends finding a product that combines this potassium nitrate with the stannous fluoride we discussed earlier. Sensodyne sensitivity and gum is the example given in the text.
Which is brilliant when you think about the mechanics of it. The stannous fluoride physically blocks the tubules over time and kills the bacteria, causing the gums to recede in the first place.
Right.
While the potassium nitrate immediately shuts down the nerve pain. So you're stopping the symptom and curing the disease simultaneously.
And that dual action formulation is critical for patient compliance, too. If brushing hurts, people avoid brushing that sensitive area, which just allows more bacteria to gather and accelerates the recession.
That makes total sense.
Yeah.
Now, the clinical blog post also takes a bit of an unexpected turn into natural alternatives.
Yes, the essential oils.
Yeah, and when I read essential oils, my mind immediately goes to the lavender diffuser sitting in my living room, you know.
Sure, yeah.
The idea of using that to fight a serious bacterial infection in my mouth sounds like a massive leap of faith into, like, holistic marketing.
I get that.
Oh.
It is really easy to dismiss them as purely cosmetic flavorings. But in the context of clinical oral care, we're talking about highly active, concentrated chemical compounds.
So it's not just a nice smell.
Not at all. Specifically, the sources highlight thymol, eucalyptol, and menthol. When calibrated at clinical concentrations, these do far more than just make your breath smell fresh. They are potent antimicrobial agents that physically interact with the bacterial structure.
How do they actually kill the bacteria, though, if they aren't a traditional pharmaceutical compound?
Well, they're highly lipophilic, meaning they love fats.
Okay.
The outer membrane of these harmful oral bacteria is made of a lipid bilayer, so the layer of fats. These essential oils penetrate that lipid layer, disrupt the structural integrity of the cell membrane, and basically cause the cellular contents to leak out.
Whoa.
Yeah, they basically pop the bacterial cells like microscopic balloons.
That is quite an image.
And furthermore, they actively neutralize volatile sulfur compounds. Those are the specific chemical byproducts produced by bacteria that cause severe halitosis or bad breath.
Oh, good to know.
So for patients who have high sensitivities to synthetic active ingredients, or who simply want a powerful maintenance tool between professional cleanings at a clinic like Omni Dental, clinical essential oils are a highly effective route.
Seeing how carefully these active ingredients, whether it's synthesized stannous fluoride or clinical thymol,
Yeah.
are calibrated to protect the tissue, it makes me incredibly suspicious of the standard ingredients that manufacturers just blindly pump into everything else.
You should be suspicious.
The sources highlight some specific villains in the toothpaste aisle, and the first one is SLS. What is the actual function of sodium lauryl sulfate?
SLS is a surfactant. It's purely a detergent and a foaming agent. It just lowers the surface tension of water, allowing the toothpaste to lather and foam rapidly in the mouth.
But what does it do for my teeth?
It has absolutely zero medical, structural, or antibacterial benefit for your teeth or your gums.
If it offers zero medical benefit, why is it arguably the most common ingredient across almost every major brand?
Pure psychological conditioning.
Are you serious?
Yep. Over decades of advertising, consumers have been trained to associate heavy foaming action with cleanliness. If a toothpaste doesn't froth up into a thick foam, people feel like it isn't working, even if the active ingredients are doing their job perfectly.
So we're risking our gum health just for the sensory illusion of being clean. What is the actual biological cost of that foam?
The cost is severe tissue irritation. The inside of your mouth is lined with a delicate mucosal layer. Clinical studies repeatedly link the daily use of SLS to the stripping away of that protective mucin.
Ouch.
Yeah, and for sensitive patients, this directly causes an increased frequency of aphthous ulcers, which are commonly known as canker sores, as well as persistent burning sensations and dry mouth.
If you're someone who constantly suffers from canker sores and you've just been buying whatever standard paste is on sale, checking the label and switching to an SLS-free formula is a completely cost-neutral way to potentially eliminate that chronic pain. Just drop the soap.
Exactly.
But as irritating as SLS is, the sources flag a much more destructive, trendy villain, activated charcoal toothpastes.
Oh, the charcoal trend. The speed at which activated charcoal permeated social media, despite the overwhelming and immediate warnings from the clinical dental community, is just astounding.
Why is it so bad?
These products are incredibly dangerous for long-term oral health. First and foremost, the vast majority of charcoal formulations completely lack any form of fluoride.
So you're entirely abandoning the remineralization process, just zero cavity protection.
Zero. But the real catastrophe for your gums and your enamel comes down to abrasivity. Dentists measure how abrasive any given toothpaste is using a standardized metric called the Relative Dentin Abrasivity Scale, or RDA.
RDA, okay.
Right. For context, plain water is a 0. Standard daily toothpaste usually sit around 70 or 80. Anything over 100 is considered highly abrasive.
And where does charcoal sit?
Many of these unregulated charcoal toothpastes score dangerously high, well above the safe threshold.
I really want to visualize this abrasivity, because people buy charcoal because they want to scrub away surface stains to get bright white teeth.
Right, it's the marketing, yeah.
It's basically like looking at a stained, beautiful hardwood floor and deciding the best way to clean it is with heavy grit, coarse sandpaper.
That is exactly what it's like.
You will definitely scrape away the coffee stain, but you're permanently destroying the polyurethane finish, which is your enamel. And in the process, you're completely tearing up the baseboards, which are your gums.
And just like that hardwood floor, once you strip away the protective finish, it never grows back.
Right.
Enamel is the hardest substance in the human body, but it contains no living cells. It cannot heal a mechanical scratch. You are physically traumatizing the gum tissue, pushing it back, and exposing the softer dentin underneath.
Which causes the sensitivity we talked about earlier.
Exactly. And ironically, because dentin is naturally yellow, scrubbing away your enamel with charcoal eventually makes your teeth look permanently darker, while simultaneously causing severe, irreversible sensitivity.
So just avoid the charcoal entirely and stick to clinically proven chemistry.
Please do.
That leads perfectly into the final crucial piece of the puzzle from the sources. Because you can go to the store today, you can carefully check the labels, dodge the SLS, dodge the charcoal, and buy a perfectly formulated stannous fluoride and potassium nitrate toothpaste.
Right, you can have the perfect chemical formula.
But chemistry requires a delivery system. If your mechanical delivery is flawed, the chemical formula is completely useless. The sources emphasize this thing called the 45-degree rule.
Ah, yes, the mechanical technique.
I'm stuck on this rule, honestly. If the sticky plaque biofilm is plastered to the flat surface of the tooth, brushing straight on at a 90-degree angle seems like it would provide the maximum friction to scrub it off. Why are we intentionally tilting the brush?
Because the most dangerous bacteria aren't actually sitting on the flat, exposed surface of the tooth. They're hiding in the gingival margin.
But what?
The margin where the gum meets the tooth. Your gum tissue doesn't attach perfectly flush to the tooth like a sealed wall. There's a tiny microscopic collar called the sulcus, where the gum naturally sits just slightly away from the tooth.
Okay, I'm picturing it.
If you brush straight on at 90 degrees, the bristles just splay out across the flat enamel and completely miss the pocket.
So you're basically cleaning the driveway, but ignoring the massive gutter full of debris right next to it.
Exactly. By angling the bristles at exactly 45 degrees toward the gum line, you allow the tips of the bristles to gently sweep slightly under that microscopic flap.
Oh, wow.
Yeah, you're mechanically breaking up the hidden biofilm and actively sweeting the stannous fluoride medicine directly into the infectious pocket where it is needed most.
This requires a massive paradigm shift in how we think about brushing. We're taught as kids to scrub vigorously, right? To create friction.
We are, but it's wrong.
Brushing shouldn't feel like you're scrubbing the grout in your shower. It needs to be a gentle, deliberate massage. You're massaging a chemical compound into the margin.
Yes, exactly. 2 full minutes twice daily, utilizing gentle, circular, sweeping motions. If you apply aggressive horizontal scrubbing force, you actually counteract the toothpaste because you're mechanically tearing the fragile gum tissue you're trying to heal. You just accelerate the recession.
And the tools we use to perform this massage matter just as much, don't they?
Yeah.
The sources are very specific about the hardware.
Very specific. You absolutely must use a soft bristled brush. Medium or hard bristles are just too rigid to flex under the gum line, and they simply cause trauma.
Good to know.
Furthermore, you have to replace the brush head every 3 months. As bristles wear down, they splay outward. A splayed brush physically cannot hold a precise 45-degree angle. It just crushes against the tooth.
What about electric toothbrushes?
Electric toothbrushes are highly recommended, specifically those with built-in pressure sensors. They eliminate human error by flashing a light or stopping the motor entirely if you push too hard. It literally trains you to use that gentle massage technique.
That's super helpful.
And finally, a toothbrush can only reach about 60% of the tooth's surface. The spaces between the teeth are highly vulnerable. Daily flossing or the use of a clinically validated water flosser is just non-negotiable if you want to disrupt the biofilm in those interdental spaces.
When you look at the entire picture we built today, the core message from Dr. Poles and the comprehensive team at Omni Dental is actually incredibly hopeful.
It really is.
Early-stage gum disease, known as gingivitis, is entirely and fully reversible. If you were catching the warning signs early, a bit of pink in the sink when you rinse, persistent bad breath or slight tenderness, optimizing your chemistry and your mechanical technique is the most affordable and least invasive path forward.
Absolutely. It's the crucial difference between investing in an optimized, scientifically backed tube of toothpaste today versus requiring highly invasive procedures like deep root scaling or laser gum surgery down the line.
And if you're in the Chicagoland area, the hygiene team at Omni Dental Group in Arlington Heights is actively available to help you refine this routine. Their patient-first philosophy means they even encourage patients to reach out for personalized toothpaste recommendations tailored to their specific needs. It's a fantastic proactive resource.
Highly recommend reaching out to them.
We have covered a massive amount of chemical and biological ground today, from the fluid dynamics of microscopic tubules inside your teeth to the very real, terrifying pathway between your gum line and your cardiovascular system. But I want to leave you with a final lingering thought to ponder the next time you're standing under the fluorescent lights in the pharmacy aisle.
Lay it on us.
Building on that fascinating link between oral bacteria and heart disease, if simply swapping out a $3 tube of toothpaste and changing the physical angle of your wrist can literally reduce the infectious bacteria flowing directly into your heart. What other tiny, seemingly insignificant daily hygiene habits are secretly acting as full-body medical interventions in disguise?
That is a wild thought.
Thank you so much for joining us on this deep dive. Stay curious, read the labels, and we will catch you next time.